here at the conference, lots of talk about advances in medicine. One in particular was a bioabsorbable stent to be used below the knee. There's also what used to be known as the PQ bypass. It was actually purchased by Endologics. It's now called P.A.D or Detour. And their booth is sitting right across from us right now. What advances in medicine are really catching your eye and you're most excited about?
Yeah, I think that, we certainly have not solved the problem. There are patients that, despite what we do, they have aggressive disease or the arteries continue to block up. So new advances like PQ bypass, for example, is an option for patients that have severe blockages or are unable to be treated conventionally with a stent. There are some limitations in who it applies to. But there are techniques like that are being developed without, getting into a whole lot of the details that confuse people. But there are options, because even in the best circumstance, even if I have a perfect outcome and someone that has CLI, the chance of limb salvage is 90+%. There's still 10% of the people are going to lose their leg. So we haven't got to that 100% cure per se, that number yet. So there's people that are always kind of working on making things better, and new devices, new technologies, things like that.
There's a lot of resistance in some practices that they don't want to treat below the knee. They still don't think it's worth it. They still rely upon 2013 data that says it's not worth it to treat below the knee. You're only going to increase the chance of amputation. But a lot of new technologies are coming out. Do you think that we're going to see a change of heart sooner rather than later with this philosophy?
Yeah, I do. I think that the tibial world specifically that you're talking about, or the arteries in the calf, is for the P.A.D world kind of the last frontier, and it's probably conservatively 10+ years behind the rest of the technology we use anywhere else. There's a lot of reasons for that through history and stuff, but I do think there's now companies that are starting to focus on that area. Tibial arteries, the calf arteries, are difficult because they're relatively long and they're a relatively small diameter. So they go from roughly your knee to your ankle, but they may only be 1/8 of an inch or less, 1/4 of an inch in diameter, whereas the arteries in your thigh or above that are significantly larger in diameter. And so as you get down into smaller and smaller arteries, it takes less and less plaque, if you will, to re-occlude those. And so they don't like to stay open very long. Plus, the disease process in the tibial arteries is a little bit different. It's probably has a little more calcium in it, which is harder to treat sometimes. But I do think that companies are starting to focus on that area a little bit more. And we're starting to see now a number of companies that have new devices that are coming out or in clinical trials that will be hopefully available in the next couple of years. One of the frustrations from my standpoint has always been, and this is as long as I practice medicine, is our FDA approval process is excruciatingly slow. And they have reasons for that, but it's the government bureaucracy. And you could look at something today and say this is great, but it's still maybe 5-10 years before it reaches the market. And so there's quite a delay in a lot of these things, but there is a lot of work going on in that arena.